Megan Champion. I'm a family nurse practitioner. I'm also the clinical director of Sheridan Health Services for CU Nursing.
And what do you do here at Trifinio?
So, most of what I do is clinical practice back in the States. But because my clinical practice is owned by the College of Nursing, I get the opportunity to take students down here, grad students. Yeah, my role as faculty allows me to be able to kind of teach as well. And so I bring a group of 6 students down once a year.
Was there a reason you specifically chose to come to this site here in Guatemala?
Um, well, I mean, I think the choice of country is because of my language ability. I think part of the reason why I was asked to lead a trip of students is because I am fluent in Spanish. And also the work that I do back home has to do with sort of global health at home, taking care of patients who maybe don't have insurance or maybe who are newly arrived to the country. And so Spanish language, I think, is the reason for Guatemala. But the reason why we come to this site is because, CU has a relationship with the site down here and has built that relationship for many years. So the first time that I came down, it was actually with other teachers, other faculty, other professors to learn more about the different branches of work that happen down here. The nurses that go out into the community, the ability to train medical professionals in the clinic, but then also the research that's happening. So,
Is there stuff that you have learned specifically about clinical and medical care while here at Trifinio?
I mean, absolutely. So, while in a lot of ways the patient population that we see here is similar to what I see at home in my practice setting. So, I work in a community health center, which means at least half of my patients don't have insurance. The other have public insurance or Medicaid, so it's a resource limited setting for those individuals. So there's a lot of similarity as far as being able to work together with your patient about what their health priorities are and how to sort of incorporate their values into the plan so that they know that you are spending their money wisely, right? And also helping them achieve the goals that are important to them. At the same time, there's a huge difference. I mean, this is an incredibly impoverished community, more so than the one that I treat back home. So really, there's more delicacy and there's more at stake and there's fewer resources. One of my favorite things about the work that I do back home is being able to see a need and fill the need. And I think here, what's exciting about this work is that they see the need and they're still working on putting all those pieces and resources together in order to fill the need. I mean, one of the things that we were just talking about this morning was the lack of like recognition of, they recognize mental health care, but that's like a growing field for the clinic here. And so learning how to incorporate things that are accessible to the patients that are in the community, trying to understand maybe stigma around medications, trying to understand how mental health is perceived in the community so that we can respond with a plan that's accessible, responsible, and acceptable to the community here.
Accessible and acceptable.
Yes.
And with that being that you are a Spanish speaker from America, is there stuff that you have learned specific to the Guatemalan community or culture here?
I mean, this so much. Where do you begin?
Whatever your favorites or all of it.
Yeah. Hmm. I mean, I think like in any small community, there's an interdependence, which can be beautiful and can also make things challenging at times. Cycles can be hard to break, habits can be hard to break, but also the support, the family support, the family units, the strength in those family units, and the faith, right? So this is a very highly religious region of Guatemala. And you see that faith come through and the family units come through as really stabilizing factors for the patients here. Um, that's been something that's been an honor to witness and see as we do our work in the community and see the way people interact in their homes. Also, the way in which the nursing team, so the community nurses that go into the homes, they're really highly educated, so smart, so capable, and they're really practicing in an advanced practice nurse role, even though that role doesn't technically exist here in this country. They do have their own levels of nursing, and regardless of the training, the nurses in the community programs are going out and um, diagnosing, managing, evaluating, critical thinking, and watching them do that work and watching the way that they're received by the community. I mean, they are revered, hands down. Like, you see that relationship between the nurse and the patient. It's so strong here. It's a very different healthcare delivery model, going into the home, going out on your tuk-tuks, bringing what you need, bringing the medicines you need, bringing the tools you need to measure, evaluate, weigh. Very different healthcare delivery model, but watching the way that it works and works really well. Like, it's so effective here because the nurses are present in the community. Everyone knows them and everyone respects them.
And has that social comparison between the U.S. healthcare system and then here in Guatemala revealed anything or taught you anything about the American healthcare system and medical care?
Truly, I think the biggest contrast that I see is the role that the government can play in healthcare access, right? And so while I criticize or sometimes think about gaps and areas for opportunity in the US for our government to have an impact at that, at that level, the patient level, I think when I see here, that okay, we've established a system, but we're not supplying the system with trained healthcare workers, or we're not supplying the system with a constant stream of birth control or vaccines, then you really see no matter what system is created to serve the patients by the community members who know what they need, if the government isn't taking an active role in making sure that those systems are in place, they can't be successful. And I think that's something that, you know, we have at stake too in the United States, and that we need to really think about and be thoughtful about the ways in which our programs and our systems that we've put in place are supported by our government. Without that support, we can't be successful in treating the patient.
Is there equipment or methods or processes that would be most beneficial here in Guatemala?
Yeah, I was thinking about that question. I mean, honestly, the amount of technology that we use in my practice back home is not astronomical either. I mean, really, an electronic health record was just implemented here. Certainly room for improvement there, and possibly room for AI to help capture and improve consistency of charting and standardization of care. I think what I'd maybe like to see most would be a biogram. So, understanding um, the epidemiology of the area, the drug resistance patterns in the area, so that providers have a tool to practice, antibiotic stewardship. I know that antibiotic stewardship has been an issue here. They have to stamp every antibiotic, even though like every antibiotic prescription needs a stamp by a licensed physician or practitioner. But you can also just go into the pharmacy and grab antibiotics and steroids and really um, do damage do damage to yourself, but also to the community, because when too many people are doing that, then we build up drug resistance and the drugs that we have no longer are effective. And so I think a biogram would be amazing. Electronic resources, we use a lot of apps on our phones back home to help with decision making and help make guidelines readily available. And so standardization of practice through use of those kinds of healthcare apps, that's not something that I see routinely implemented here that could help. But other than that, I mean, the electronic health record, yeah, I don't know. I couldn't really think of more tech. I'm not a very tech person, so
Yeah.
that might be why.
Is there tech or just basic equipment that you use most on an everyday basis
I
while
mean,
you're here?
the ultrasound that, that we have kind of tried to implement ultrasound on the spot to prevent people from having to go to Cotopeque for those imaging studies. We use those in maternal child. We use those in uh, for like abdominal as well, a chest X-ray machine or some kind of X-ray capability. And then the other thing that could be useful that I've seen at home is like an e-consult, so that we can more readily communicate with the specialists in Guatemala City, even outside of Cotopeque, to send pictures and ask questions securely through a system. Like that's kind of rural health 101, getting the specialists into the practice.
Are there most common medical problems that we see here at the Trifinio clinic?
Oh yeah. So there's definitely, I mean, the Trifinio clinic brings a good variety, but the variety is primary care and trop med. So you see a lot of dengue. You can see a ton of parasitic burden, GI illness, anemia, malnutrition, and then chronic disease management. So hypertension, diabetes, just kind of like your run of the mill chronic illnesses. And I think what's hard for patients here is, they may make the trip to come see us here and get a diagnosis. I think that people are good about taking their initial round of medications. It's the follow up. And when you want to prescribe a chronic medication, how can we make that easier for patients? So, is there a way to implement outlet pharmacies or so outlet pharmacies are like, something that was maybe associated with the clinic so that it's like run a little more tightly,
Yes.
right? Rather than going to the pharmacy and getting whatever. Or like a delivery service or something along those lines where we can help people stay on their chronic meds. Because that's what I think I see is like, well, I took it for a couple months, then I ran out of pills and I didn't come back and I feel okay. And you're like, you do feel okay, but you're not okay, right? Your diabetes is raging or your hypertension is uncontrolled.
Is there anything moving forward that you would want to understand better about the Guatemalan community or how to better integrate healthcare and personal health with them as a medical professional?
Yeah, there's a couple things that I'm interested in. I mean, on a broad level, I'd like to know more about the government's role and accountability for, the programs that they support. I have been fortunate enough to visit the Centro de Salud that's by the Coatepec Hospital and see kind of the programs that they offer there. But I'd like to know more about the Guatemalan government at large, how decisions are made, and what kinds of programs they have to fund different, puestos and outlet communities like we have here. On a more intimate level, like in this community, what we were talking about was sort of the relationship between mental health and physical health, and how, we are doing a better job at reaching people to diagnose their physical health, and how sort of the idea of mental health is up and coming, and what are the ways in which we could partner with the mental health resources that are here to kind of build a stronger program to screen and identify mental health sooner and provide complementary treatment plans. So like we were talking about, the accessibility of therapy, but also medications and where do they fit in. And I think there is I think there's an education gap because of a social taboo and, things that we don't know about. We don't use things if we don't feel comfortable with them, and if you don't have a brother or sister who's been on it or a friend who's been on it. And then birth control, so like long-term birth control, I think could really be useful here, as long as we had a program in place that's culturally sensitive to assess and evaluate the people who would be eligible, good candidates for it. But when you're done having babies, right, when you and your family have decided that you're done, could we put in some IUDs? Those aren't used here, and they're great. They're good for 10, 11 years. So those are two areas where I feel like if I could understand a little bit more about the perception in the community and the barriers to these kinds of things, I think they could be helpful.
And your desire for the community perception goes right into our favorite question. If you had a medical magical wand, to make the community members here more aware of medical health care or their personal health with a greater understanding, what would it be?
Yeah. You can have your faith and still pursue a quality of life improvement, right? Like, those two don't need to be mutually exclusive. And choosing your family size is so culturally sensitive and so closely related to those values and that faith. And so while I, hold those values close to home for myself, I am thinking about, like, if I had a magic wand, would I want to say that to everybody? No, right? Because that's disrespectful and disruptive, but like understanding that you can have both would be the change that I would magically make if I could make that change. Does that answer your question?
Absolutely. Anything else you would like to share?
No. I love it here. The people are amazing. The team is amazing. Thanks.